Good afternoon to everyone. Happy Friday Eve, as we fondly call Thursday, which is definitely an indication that we need happier workplaces, right? When we look forward to the weekend so much. But welcome, welcome, welcome. Today is Mental Health Action Day. And here at Limitless Life and Thrive Well Corporate Solutions, we are pleased to provide a webinar series all month of May as we celebrate Mental Health Awareness Month. And we thought it fitting on Mental Health Action Day, which is actually today, to have a very topical conversation around the safety of our workplace. And we're not talking just about physical hazards and whether or not that piece of carpet is a trip hazard, or if that tile that's breaking is a hazard, or do we have mold in the building? We're not talking just about that. We want to talk about how psychologically safe is my workplace. Studies are showing now more and more. Gallup just released their new statistics of the fact that employee engagement is declining, and it's continuing to decline year after year. And what is it that employees are looking for? Employees want to feel safe. They want to feel supported. They want to feel nurtured. They want to feel that they're growing. And so we want to have a very open conversation today about what constitutes workplace safety from a psychosocial and a physical perspective. Today, joining us, we have a very esteemed panel. I am honored that all of these people said yes to my request. And I'm going to ask them to very briefly introduce themselves and their role. And I will start with the Honorable Minister Pia Glover-Roll, the Minister for Labor and Public Service. Welcome, Minister.
Thank you, Simmone, for having me. And you just did my introduction. I am Pia Glover-Roll. I am the Member of Parliament for Golden Gates and the Minister of Labor and Public Service. But most importantly, I come from a background of human resources. I'm a human resource professional. And so when we talk about all it takes in the workplace to be a decent working environment, when we talk about the topic of mental health in the workplace, this is something that has been close to my heart for decades. So it's great to be here and to join this very esteemed panel.
Thank you very much, Minister. Next, I'd like to move to Mr. Robert Farquharson. Please introduce yourself. You're muted.
A pleasant good afternoon. I too want to say how pleased I am to be invited to this panel. My name is Robert Farquharson. I serve as Executive Manager with the Ministry of Labor and Public Service, formerly the Director of Labor, where I served for a number of years and had responsibilities for occupational health and safety in the Bahamas. Good to be here.
Thank you. It's good to have you as well. And now I'll move to Dr. David Daniels, who is joining us all the way from Atlanta, Georgia. Woo! One of my favorite cities.
Right. Simmone, first of all, thank you for the invitation. I am absolutely honored to be amongst the cast of characters that you've assembled for this conversation. So my background, my professional background is in the fire rescue service. I was a fire chief in about 3 locations in 3 different states in the U.S. And about halfway through my career, recognized I was really more interested in occupational health and safety. So I pursued a doctorate in occupational health and safety, and I studied psychosocial hazard mitigation. And this is a wonderful conversation to have because this is right in the center of my wheelhouse relative to my research and the things I'm really interested in talking about today. You know, again, early shameless plug. I'm so interested in it. I just wrote a book and it's been out for about a month. I'm always happy to share more about this entire topic. So thanks a lot for the invitation.
It's good to have you. And our final panelist is Dr. Thomas Smith. I see he went off camera for a minute, so I don't know if he had to step away for a moment. Are you there?
Yeah, I'm here. I'm puzzled as to why the video has, and I'm not able to engage it. Apparently, I'm being blocked. I don't know. But anyways, good afternoon to everyone. Thank you so much for inviting me, Simmone.
Yes.
So now the co-host is allowing me to start my video. Okay, let's just do. There you go. And good afternoon, Minister. And I just want to publicly congratulate you. I think your background and career path has shown through. I was so happy to hear you're engaging and taking up this medal, and I really do hope that it does happen. I'm a psychiatrist by trade, and I've been doing corporate mental health workshops for a while. And so, yeah, I'm hoping for a very good and informative discussion this afternoon.
Thank you so much. Thank you, Dr. Smith. And let's dive right in. Thank you to all of you who have joined us today from wherever you're joining us from. And if you feel free to share in the chat where you're joining us from, whether you're from the Bahamas and where in the Bahamas. And if you're not from the Bahamas, you can certainly share where you're joining in from today. So I'd like for us to start with just some baseline definitions, because I think that that also helps to frame the conversation today in terms of defining some of the key terms that we will talk about. So, Dr. Smith, I'll start with you. How would you define mental health versus mental illness? If you can start there for us, please.
Thank you so much for that, Simone. So, mental health, as defined by WHO, basically is a concept that allows us to feel, it's a measure of your well-being when you take into account your psychological environment, your emotional environment, your spiritual environment, and it also allows the person who has mental health to basically withstand or go through life stressors or the vagaries of life, and be able to function in a way that is productive as well as contribute to the overall community. So in layman's term, basically you are in a position where you from day to day you're balancing off your emotional and mental well-being, psychological well-being to the point where you're actually able to, withstand more than just a hurricane, maybe a flat tire, right? To a point. And then after that, if things gets a bit more than that, you may want to sort of like strengthen it with psychosocial support. Now, mental illness, that is a degree of mental health that is not basically meeting all of that individual's demand, so to speak, psychologically speaking. So that could be a disturbance in the way how you're thinking, disturbance in your emotional health, disturbance in the way how you behave. So there's a concept that connects your thoughts and feelings with your behavior. And so when you're not feeling mentally well, those three modalities could be impacting on your person. Okay. It may not be to the point where it is a need for a direct intervention, but when you're experiencing a mental illness, that is when your function is impaired, your physical function is impaired. It's interfering with your social and your daily functional life, basically.
Okay, thank you for that. Dr. Daniels, I'd love for you to define, since this is your wheelhouse as well, what does a psychosocial hazard mean?
So, a psychosocial hazard is a psychosocial factor, particularly at work, The concept of psychosocial factor is actually created by the World Health Organization, the International Labor Organization back in the 80s, and it looks at the individual's role and then the organizational context of their role. So a psychosocial factor that's perceived or experienced by the person exposed as threatening, and threatening to the extent it changes their behavior. So again, that definition is unique to my research because there's an international standard that addresses psychological health and safety, but it actually talks more about psychosocial risk. And when we have conversations about safety, I think it's important to connect. Risk is the product of vulnerability to a hazard. And often when we have these conversations about how risky things are, how dangerous things are, we sometimes don't go all the way back to find out what is the root. And again, a hazard is anything that can cause you harm, not just physical things, but also emotional things and situational things and temporary things and permanent things. If it has the potential to cause me harm, it is hazardous to me. And so when we talk about a psychosocial hazard, it is, in this conversation today, is my workplace safe? Often your workplace can be extremely safe from a physical perspective. I'm not going to slip and trip and fall. The building's not going to collapse. It's not going to catch on fire. I'm not going to be exposed to chemicals, but I could be exposed to a situation or a circumstance that I perceive as threatening and harmful to me. And so much so that I change my behavior. I can't hear the next thing that you said because I was triggered by the first thing. I can't go into that meeting because of how I was treated in the last one. When these conversations come up about particular topics, it triggers me because of my experience. So, and I think that's a really important distinction. Psychosocial hazards are particular to a person. Some of them are unique. Some of them are kind of across the board. Most folks would feel that way, but many of these hazards are unique to the person.
Thank you very much for that. I'm really holding myself back from digging into that now, right? So many things come to mind to talk about, but I'm going to stay focused on these definitions. Mr. Farquharson, please define for us the difference between legislation and policy. You're muted again.
Thank you. The Bahamas statute that govern occupational health and safety is called the Health and Safety at Work Act 2002. That sets out the legislative obligations and duties of employers, employees, and persons who operate in the world of work in the Bahamas. There are some regulations that enables the act to be facilitated. An example is the act makes provision under Section 11 for an inspector who is an officer in the Department of Labor to have the legal authority to go out and inspect certain premises to make sure that the work environment is safe. The regulations outlines his duties, what he has to do first, and that's the difference between the statute and the regulation.
Okay, thank you. So I'd like to throw the first question to you, and then I'll jump over to Minister as we are talking about legislation, policy, and I'd even like for you to share some of the things that you have coming up as soon as next week. But what are some of the common workplace safety concerns that come to the ministry, the Department of Labor?
As you know, we first of all just came out of the issue of the COVID-19 pandemic. So we had a cadre of complaints and concerns regarding the spread of COVID-19 is the workplace safe. But for the most part, in the Bahamas, complaints that come into the Department of Labor are those physical issues that present a hazard in the workplace. Particularly, let's say the construction industry, where persons who don't come to work in the safety hat, don't come to work with safety shoes, and if they have an industrial injury in the Bahamas, our Social Security scheme, it puts a cost to them. If you work in an unsafe environment, you work on scaffoldings, the scaffoldings are not properly constructed in the construction sector. If you work in the aviation sector, you're not supposed to go to the airport ramp without a proper a vest. to make sure that you can be seen. If you work in an office environment, the type of chair that you sit in, make sure there are no electrical wires running along the floor. Does the building have a fire hydrant? Have fire extinguishers? Has the elevators been checked on a regular, consistent basis? All of these things are some of the issues that come to the Department of Labor. We have a unit in the Department of Labor called the OSHA unit, and their job is to investigate these complaints, to visit these complaints and make sure put what we call improvement notices. A typical example, a couple of years ago, we had a complaint coming from the Bahamas Electricity Corporation, where there was concern about the leakage of fuel. The Department of Labor sent a team down there. They investigated. They came up with facts that yes, the fuel was indeed leaking. It was hazardous to the employees and of the company, and so they had to issue what we call an improvement notice under Section 11 of the Act. And the management of the company was given a certain time frame to clean it up. If they didn't do it, then we had the legal authority to issue what's called a prohibitive notice, and that notice would have tell them you are not allowed to work in this area until this is corrected. And so those are some of the things that outline the law, some basic things that we operate on in the Department of Labor.
Okay, thank you. And so it's interesting that you reference, as you mentioned, a lot of the physical hazards. Minister, I'd like to address this question to you. How has the ministry and the government recognized the prevalence of psychosocial concerns, and what is being done to address those psychosocial hazards that present themselves? You're muted as well. Still muted.
All right, I think I'm there now.
Yes.
So, you asked about psychosocial and basically the mental health. When I heard Dr. Thomas speak about mental health, mental illness, mental health is the coping ability. And what have we done? Well, first and foremost, I think what is most prominent that sticks out for me in terms of solution is the fact that in 2022, we ensured that the Mental Health Act was passed. That now gives us the framework that we need. You heard Mr. Farquharson talk about the statutory framework to be able to enforce, to be able to build policy. And something that we're doing right now that we're actively involved in is, of course, ensuring that we're drafting and reforming new legislation that brings our statutory framework into the 21st century. When back in the day, mental health was taboo. So if being taboo definitely wasn't addressed in law, wasn't addressed in policy in our workplaces, and that's public and private sector. So now we've taken the leap of ensuring that we're reforming our law and we're including mental health. What does that look like? That looks like, first of all, the definition. What is mental health? What is mental illness? How are we going to ensure that there are clear lines in defining those? What type of recommendations can be made? While there are a number of opportunities for counseling, there's also opportunity for training, because if we delve into the psychosocial, that has to be identified by the people in your workspace. That means as a leader, I have to be in tune with my staff. That means I don't walk past your cubicle every day and not notice if you're living or dead, not notice if you're happy or sad, not having the leadership empathy that's required to be able to connect with my employees, not only expecting productivity, but when that productivity slows down, when there is depression from a normally happy person, when this person is now calling in who was probably had excellent record, are you connecting as leaders? Are we connecting as leaders to understand what's happening in our environment? We could go more into that, but we also want to look at how families are now evolving. The pandemic natural disasters have forced us into certain workspaces, remote work. How does that help our employees' mental health? Is there the possibility that based on your position, your post, your requirements, that maybe there's opportunity for flexible work schedules, there's opportunity for remote work that now helps with the overall picture of balance? Because yes, you are a worker, but you're also a mother, a father. Someone is relying on you outside. We want to ensure that we are fostering proper work-life balance. So how are we as an organization embracing that part of the psychosocial? And then a big one for me that I think has been void in so many places, in particular in the public service, is reward and recognition. We can't take for granted that reward and recognition isn't a tool to help with mental health of our workers. An occasional thank you, an occasional staff recognition, an occasional appreciation opportunity, an occasional promotion. Let's get on that topic. Training opportunities that shows that as an employer, I'm interested in your upward mobility. So that's when we talk about the psychosocial. All that feels good and looks good isn't always good, but how as leaders are we connecting with our employees to make sure that they're in a good space?
I love that. I love that. And I'm glad that you raised that, because I think particularly what research is showing is that a large part of the responsibility for the environments that are created lay at the feet of leaders, right? Oftentimes when we think of bullying and so forth, we may think that that's peer to peer, right? Colleague to colleague. But quite often it is this top down abuse, for want of a better word, right? And sometimes it can be unconscious. So yes, I may walk past your cubicle and not notice you because I am just overwhelmed. I'm thinking about a lot of things. I'm not aware. I'm not socially aware of what my behavior is doing to you. But it could be as deliberate as you mentioned, perhaps withholding a promotion or withholding someone or excluding someone from training or excluding them from a meeting, or making them or creating conditions that make them feel that they don't belong or that they are not welcome, that their ideas, their contributions are not valued, right? And all of these things kind of add up to what we call now these psychosocial hazards. So I'll start with Minister, and we can hear from all of our panelists on this question. What role does leadership play in the mental health and well-being of employees?
Well, leaders should model the behavior. That sounds good in principle. That's why I said should. But I believe that training is critical. When we focus training towards our employees for skill sets purposes, I think as we focus leadership training, it should be focused on, I call it a holistic approach. How do you manage people? How do you interact with people? I know back in the days of my human resource days, where we took the time to do the DISC analysis so we can understand, when we forming our teams, are we putting the right personalities and the right work ethics together to ensure that there is success? So it's important that we also touch on training for leaders. I always lament that in the public service we promote, but are we ensuring that there is sufficient training prior to and during the course of being moved up, to ensure that not because of tenure am I placed in a role, not because I've been here for 20 years, so now I should be in a role, but do you have the capability, do you have the capacity to manage people, to manage processes? So training is critical to ensure that. And that's where policies are also developed to ensure that we're policing the people that are in charge, and ensuring that there are some lines, some clear lines. So for me, in leadership, I believe that it's important that you model the behavior, but you can't expect someone to model the behavior if they don't understand the behavior, or they don't understand that the role that they should play.
Absolutely critical, ensuring that people are fit for the role, that they're ready for the role, that they are prepared for the role. I think they have some very important points. Coral said in the comments here, there's a weakness in the follow-up on whether or not leaders are setting good examples. So I think that's that measure of accountability. Now that I'm in the role, who is measuring me to ensure that I am doing what I'm supposed to do as a leader? Dr. Daniels, what's the role of leadership in maintaining mental health and well-being for employees?
Well, first, I will say that the leader's most important responsibility is to create a psychologically and physically safe environment for the folks that they lead, period. If they do that part, if they're effective at that part, all of the other things, the productivity, the profit, the other, measures of success will come. Because if that's not your priority, it would be better to simply have a bunch of machines. Unfortunately, many of the systems we have in place today were created during the Industrial Revolution, when we looked at everything as a machine, to include the people. So we treated people like machines. People are not machines. They are not. They're much more complex. They are much more, they're very, very different. There are no two human beings that are exactly alike, even if they look the same. So the question is, how do I create an environment for this human being to be successful in this environment? Because the environments are different. Many, unfortunately, again, of our systems were set up at a time and set up by people who had no interest in the safety of other people. They were interested in getting stuff done. And we've begun to evolve as a species, and there's more interest now. People are more concerned about how this feels to me and how this looks to me and how this worked for me. It may work for you, but it doesn't necessarily work for me. And again, a strong leader, a confident leader, won't take that as a threat, but take that as an opportunity to get better. Because it's impossible to create an environment that's going to be perfect for everybody. It just doesn't exist. So how do we, to the extent necessary, create an environment that works for the people that we've invited? So if we're going to invite women, it ought to be safe for women. If we're going to invite the disabled, it ought to be safe for them. If we're going to invite people who are immigrants, it should be safe. Whoever we invite, we should make sure that environment is safe for them. And again, feeling is important. And you're only going to know if this feels safe to people by engaging them. I can't assume that I know what is safe for you. I can't. I know what's safe for me because I've done the work. I've done therapy myself, and I have a good sense about what triggers me. And so while I'm working on myself, I have to work with you. I'll say this and I'll conclude. Safety doesn't work when you try to do it to people. It doesn't work very well when you try to do it for people either. It works when you do it with people. We have to do this. It's not just me as the leader. It's not just you as a follower. We both have a role and we have to do it together.
Yes, absolutely right. We get certainly in the comments, people are saying there are leaders who are more focused on profit than people. They determine the difference between mental health and mental illness based on how you interact with staff. To me, that is very telling, right? That as a leader, I could push someone to the point of mental illness. And we see that happening. You talked about it, I think, Dr. Daniels, when you said that, the thought of, and I actually experienced this, the thought of going into a particular meeting made me feel traumatized. based on how I was handled in the meeting. And you may say, well, you know, get over it, right? We like to say, man up, race up, woman up, put your big girl panties on, or whatever we like to say. But we have to look deeper into these things because it's real, right?
It
Where
is.
people have these Sunday night anxieties, the thought
Yes.
of going to work the next day.
Yes.
It's real.
It is. It is. And if I can add, we spend a lot of time talking about dealing with the consequences. We send people to Dr. Smith to deal with the consequences after the fact. Why aren't we spending time talking about the condition that caused people to feel that way? So why is it that people are leaving that place, or that people are stressful over there, that people can't produce? There's something about that system itself. And again, that's not personal. It doesn't mean that there are bad people, because often this is so embedded. And until you get courageous leaders such as yourself, the minister, and others who are willing to look at that system and how can we make that system safer for people, simply swapping out leaders doesn't fix it. It really comes down to creating an environment where people know we are about your emotional and physical health here.
Absolutely. Dr. Smith, moving to you, and in your experiences, you've done a lot of work in corporate. And as Dr. Daniel said, you know, you're one of the people that people go to after they have experienced these hazards and feelings of trauma and anxiety and depression and guilt and overwhelm and burnout and all of these things that you encountered. How has leadership played a role in some of the cases that you have had to deal with over the years?
So I'm just going to agree with all of the previous comments, and they're very insightful. I just want to say a couple of things. So all of that is absolutely true. When we talk about mental health in the workplace, we tend to try to pretty much pigeonhole it in the workplace, which is true. A lot of those mental health issues do occur at work. But like the minister says, I am a father, I am a son, I am outside of the work. Now, remember we talk about mental health and having that inner ability to deal with the vagaries of life and stress? Well, a lot of our time is spent out of the work as well as in the work, right? And so there's this one statistics I want to just push out there. Um, 1 in 5 person in a given year will experience a mental health issue. Okay. Now, what does that mean? That means at any one given time, whether it's work related or not, you probably are at risk of developing a mental illness, right? Whether it's temporary, permanent, or otherwise. So persons can bring their mental health issues at work. Work can exacerbate those mental health issues depending on whether or not they are psychologically safe, or work can induce a mental health issue, right? And I absolutely agree with training with this one little piece of caveat, right? Now, when we talk about addressing the psychosocial strengthening of the workplace, what we're saying is we want the managers and the leaders, right, to be much more alert, much more aware of the psychological healthiness of their employees. As a matter of fact, in 2022, I think you might know this name. What's it called? Workforce UKG. That's a very influential firm that worked with HRs and workers. They interviewed more than 69,000 employees, and they found that 70% of the employees thought that their manager was much more impactful on their mental health than their partner. Think about that. That's giving a different spin on being married to the job, right? I mean, that's how key and how important being a leader in the workplace is. This is a real statistics. It's shocking. Now, here's another shocking thing. Leaders and managers, they're human beings, and my specialty is such that I'm trained to recognize, treat, and manage mental illness. Most people may not have that integral knowledge of recognizing when someone is psychologically unwell. So, mental health awareness and mental health training for key personnel like leaders and managers is most important. Now, and I agree with Dr. Daniels. So, when we talk about looking at creating policies, right, that addresses psychological safety. You want to make policies that address the mental well-being of the entire staff, which basically means that you want to create a platform where if Miss Simmone comes in with a broken arm. She has the ability to have adjusted hours. She has the ability to lower her load. Well, we also need to have mental health policies that someone who has a disabled mind, for whatever reason and for however long, right? People have a right to work. Mental Persons suffering from a mental illness who can work are capable of working, but they may need the same kind of allowances as someone who has breast cancer or someone who has a broken foot, right? So leadership is very important in uh, the workplace as it relates to creating it and to be psychologically safe. Calls for managers and leaders, persons and leaders to first be aware, to first be able to engage, and to know where to send or refer persons for help when they see Ms. Simone, who's a stellar employee, suddenly becomes withdrawn or becomes more absent than usual, then hey, maybe we're looking at something. So that's basically all of that in a in a short reply to your questions.
No, I think it's very profound, and we're seeing even our comments. Nev is saying here, as a people, we tend to label staff without any clinical training, and thus making them believe they have a mental illness, right? A functional individual in every aspect of their life is not one who, sorry, let me just try to move down here and see the rest of it, is not one who with an illness, but your environment threatens your mental health when you're not getting what you should from that professional relationship. So I think the point that you raise about us um, having training on what to look for, and then as a leader, not trying to take it on, you can't facilitate the intervention, but we should have a framework, a network of resources that we can now hand off, right? So in some companies, you have what we call an EAP, an employee assistance program, that may consist of a hotline where you can call, or you may have a department, maybe HR may facilitate, where you can now be referred for additional support. You may not be able to take it all on, right? And I think it's important that as a leader, you recognize that, yes, people's mental health issues are private, and that we should respect that, and that we should understand our capacity, our limitations. This is not our area of training. We are not counselors, psychologists, or psychiatrists, therapists, and we need to hand off to the appropriate people to make these assessments and to provide support. Minister, I see your hand raised. I was coming to you next anyway.
So I want to piggyback off of a point, Dr. Thomas, and segue into something else you said. So he mentioned a broken arm and mental health illness. So this is the challenge with supporting employees in the workplace when there's physical illness, it's seen it's manifested. When there is mental health illness or mental health issues, it's manifested when it's already crossed into the red zone. That's the challenge. And so that's why it's so important as a government, because we know this is uncharted water for many organizations. It was important that we legislate this mental health awareness. This framework is important to lay the foundation for organizations to understand how to cope. We talk about awareness of managers. We also spoke about confidentiality. So there's a lot of factors that proves that in organizations, whether public or private, and when we talk about public, there's different ministries and departments. Who's to say that every leader understands how to manage mental health issues of their employees? You hear the new term now, we have an open door policy that speaks to engagement, that speaks to having an opportunity for employees to come in and supposedly to vent, to be able to express themselves, for you as a leader to say, I notice there's something wrong. Would you like to come in and talk? However, there's the barrier of confidentiality that a number of employees may say. You talked about triggering. I don't want to go and talk to this leader who I feel is victimizing me. I don't want to speak to this leader who gives me severe anxiety. So these are the barriers that now we have to understand. How are we going to fix these barriers in these various workplaces? We can't just swap out people. Oh, we don't get along, so let me just send you to another department without fixing the issue, because now you're sending that issue to another department when that may not be the issue. The issue may be in your leadership style. It may be in your inability to be aware of what your employees are actually manifesting through their actions or inaction. And you talked about bullying not only coming from the top. There are instances where bullying can be paralleled to a coworker that sits right across from you. But there is an upward flow. But now we have a new dynamic too. It's invisible. It's cyberbullying. I'm sitting at my computer and my supervisor or my colleague may be sending me messages that are giving me anxiety. So the issue with this whole mental health topic is the dynamics they continue to mushroom. So the important factor is to be aware and to figure out organization by organization, by balancing on the foundation of our legislative framework. How are we going to ensure that there are employee assistance programs that are readily available for all levels of employees to feel confident and comfortable to be able to engage? That's most important.
Absolutely, absolutely. And I wrote in the chat there that trust is a serious factor. I can tell you from an HR perspective, I've had employees who would say, the policy says if you get time off, right? So we're still under the premise of whether I'm physically sick or I'm mentally not able to perform my tasks, I have to get a sick slip. And I have had employees who said, I don't want my manager to have my sick slip. Why? Because on the typical sick slip, you would have the letterhead of the doctor from which it's coming. And I don't want my manager to know. I don't want them to know anything about me. So we may have a process in place that says, well, you have to report to your manager what you're dealing with. The manager has to approve. What if you can't trust your manager? Right? So we have to tackle all of the issues, because we can't just say, okay, well, then just go straight to HR. And they may have an issue with HR too. That's a whole other topic for another day, right? But where do you go? Number one. And the second thing is, how are we addressing these problems that become the elephant in the room? Everybody knows it's a problem, but these people become the untouchables for whatever reason in our organizations, and we just keep growing and multiplying the issues. Dr. Daniels.
Yeah, I was going to share, and again, just as a, to level set, this is a conversation about workplace safety. And this is simply another safety related hazard in the workplace. And so to avoid being overwhelmed by it, how do you handle? So 100 years ago, nobody really cared about the chemicals that were in your workplace either. And you may not be a chemist, but the idea is back to the point, it's awareness. And many of our systems, again, are really outdated. They were not built to be concerned about how this feels to people. They were concerned to control people. Unfortunately, many of our HR policies are like a lot of our criminal justice related policies. It's the person's guilty until proven innocent, and we're going to figure out how to get rid of them. But that idea doesn't make a lot of sense when you're short on people. You can't find talent. So you can't afford to simply discard people who you don't agree with. It's how do we create an environment that acknowledges that people are going to have challenges, that assumes that I can tell you there is no such thing as a hazard-free environment. It doesn't exist. So let's stop acting like it. Let's stop acting like there's this perfect panacea of, everything's going to be wonderful. It's not. The idea is when we recognize it could potentially harm people, what do we do about it? And the priority is how do we create a situation and a scenario that is as minimally harmful as possible. We can't take all the harm out. If you're in law enforcement or military, there are going to be times and you're going to be at conflict. That's the job. But people should know that and not be surprised by it. That's the issue. If you're in healthcare, if you're in banking, doesn't matter. You're going to have things that are complicated. You're going to have tough conversations. But it should be about how do we do this in a way that is safe as safe as possible for everybody involved.
Absolutely, absolutely. I just called you Dr. Farquharson. Prophesied over your life. I want to get to you,
I
Dr.
received
Smith.
that.
You received that? Okay.
Yeah,
I wanted you to just address from a policy standpoint what we're talking about here. What are we doing to address these concerns from a policy standpoint?
Well, first and foremost, the Ministry of Labor and the Public Service has taken a bold approach, led by our minister, to have this matter addressed. As I stated earlier, this whole concept of mental health has been taboo in the Bahamas for some time. And the approach has been, we need to take the bull by the horn. Firstly and foremost, is identify in law the difference between mental health and mental illness. We must put in law there should be no discrimination against persons with mental health or mental illness. And first and foremost, we must implement policies and procedures to make sure that there is a framework in place to address these things. A couple of things have happened over the past 12 to 18 months in the Bahamas. First and foremost, the Ministry of Labor has led the charge of amending some statutes in the Bahamas to address these things. And those statutes are based on the principle of ILO Convention 144. We have extensive consultation with the private sector, with our social partners. For the past 18 months, 24 months, we have been meeting with the employers, with the trade unions, with the NGOs, and we have crafted a bill. And we have crafted what we call a white paper. And that white paper is at a point where we're about to go out to the public and say to the public, here's what we want to do about mental health. Here's what we want to do for occupational health and safety. Give us your final views before we present it to the government, have it debated and put in law. And it affects every worker. I had a meeting with the Employers Confederation last week, and we talk about mental health. When we talk about giving a mental health break, but just, their first response was, who's going to pay for it?
Gonna pay.
Who's going to pay for it? Not about what happens if somebody comes to work with a gun and shoot everybody up. We have to learn to address these things and put policies in place. Secondly, the government through the Ministry of the Public Service is about to consider recommendations for the ratification of ILO 155 and ILO 187. Those two critical ILO conventions will pave the way, first and foremost, to create a national policy on occupational health and safety, and secondly, a national framework. So now, who's going to be responsible for this? Which private sector organization which public sector going to do? And that's what we're doing right now. Next week, we have over 100 professionals from around the country coming together to look at submitting recommendations to the government to ratify ILO Convention 1551187. And this will transform occupational health and safety as we know it here in the Bahamas. So those are some of the steps that we are taking in the Ministry of Labor and the Public Service.
This is phenomenal. We are just so excited, you know, especially as practitioners. We have a lot of practitioners on this call. And so this is great news to know that these conversations are happening and that we have movement, as today is Mental Health Action Day. We have not just awareness, but we have action happening. One question and comment is here in the chat, Mr. Farquharson, is what about enforcement? Right? We have challenges sometimes with enforcement.
Yes. And this is so typical. I got a call from an employer yesterday. The Department of Labor was sent to that business establishment to investigate a health hazard. We got anonymous complaints from members of the public through a hotline. And when the inspectors went there, they were refused entry. Notwithstanding the fact that Section 8 of the Health and Safety Work Act says, if you interfere with the duties of health, you can be fined up to $10,000. How do we enforce it? Regulations. We're tackling that as we speak. That health inspector should be able to, once he probably identify themselves and probably have the legal authority to enter and investigate and report on those complaints. And so that's what we're doing too in the Ministry of Labor. We have drafted some regulations, about 5 regulations, which will positively impact what we do. And when the minister brings these bills to Parliament, she's going to lay the regulations on Parliament at the same time. We need every company in this country with 20 or more employees to have a health and safety committee. We need we got more than 100 people, and that committee must be included worker representatives, because all of the brains don't come from above. All the brains don't come from the employers. There has to be a holistic approach where employers, where government and worker representatives come together and work on the betterment of occupational health, including mental health.
Absolutely agree. And I really want to be devil's advocate here, but yes, I knew Dr. Daniels would be happy when he heard about that health and safety committee part. And Dr. Smith, I haven't forgotten you. I'm going to get to you right now. But let me be devil's advocate for a second now. We know the community that we live in. We will have legislation, policy, regulations, and then we have the subculture of, let me pick up my phone and call. Let me call Tom. Because Tom can get me out of paying this fine. Tom can call Glover-Roll. Work this out for me, Minister. Now, I just trying to be real here, right? This is what we face. People do not want to be held accountable for their actions or inactions. How do we address that?
In the legislation, it's designed in such a way where the Director of Labor has the independent authority to go to court and cause the court to enforce violations of the Act. The Health and Safety at Work Act, the Employment Act, the Industrial Relations Act. Independently, if we feel you are violating the Act, and right now the Act was amended in 2014, where you could be fined, let's say this, up to $10,000 a day. The question is enforcement. And that's what the minister is addressing in the new legislation that we're working on as we speak.
This is good. I am really, really happy to hear this. Dr. Smith, I know you've been ready to jump in on this.
Thank you, Simmone, again. So let's just say we're not inventing a wheel, okay? These issues that we have, well, we are moving in a very progressive way in the new way of doing things, which is, again, very enlightening for me to have the minister be the forefront runner for this. And believe me when I say that, right? Because we're a culture that pretty much wants to stay very much the way how we are. This is new grounds. Now, to address the mental health issues and enforcement of laws, the first and foremost thing we must do is to create, well, and I speak from the point of view that I was the chairperson who actually helped to co-author the new Mental Health Act. At the time, I was the how do I say this, chairperson of the Mental Health Review Tribunal, along with Dr. from someplace from Ministry of Health and Wellness. I'm so sorry, I don't Dwayne Swan. Yes, that's exactly right. So Mr. Farquharson is absolutely right. You not only must have legislation, but you must also have enforcement. Now, we're not trying to make criminals and finers of everyone, so it must also come with a bit of an awareness campaign. These are tried and true methods, right? Awareness campaign, uh, educational campaigns, because we don't want to have an adversarial position with the business community. And we want to make sure that we're not asking them to drop their standards. We just want to let them know that mental health concerns is everyone's concern. There's over $1 trillion of losses as a result of mental health in a year, right? And for every $1 you spend on mental health, the return on investment is up to $4. So it makes sense, okay? And so the most difficult thing that we face here in the Bahamas is trying to make mental health on par with physical health. And what does that mean? That means that exactly that. If I have breast cancer, or if I have schizophrenia, we're treated the same way. Okay? Simple. And that only comes into reality through legislation. Now, I may get in trouble here, but I'm going to make some news. And that also requires medical insurance companies to cover mental health as they cover physical health, right? And that only comes from legislation. I cannot tell you what great barrier it is to have, patients come and see me because psychiatry or mental health uh, um, cost a lot, to be honest. And if you're not covered by insurance, right, which some are normally covered by, it becomes very difficult to access proper health. And therefore, the problems that could be intervened much earlier becomes larger and larger and larger over time. So then there needs to be legislation to address the inequality in ways how mental health is looked at versus physical health. That's my little 5 cents.
No, this is good. And I want to come back to Minister on this, and then I want to hop over to Dr. Daniels as we can talk a little bit more in the time remaining about what the signs of a toxic workplace, because we hear that all the time now, right? My workplace is toxic. So I want us to talk about that. But on the point that Dr. Smith made, Minister, 2 points, because I wanted to ask something related to it, but this is also a factor as well. When we look at the cost of mental health care, and when we look at the government and all of its responsibilities and capacity, we already know, that our services are stretched when it comes to being able to provide services that are cost effective for the masses of our community, right? I mean, I experience it all the time of people who need help, and you're like, either you're dipping into your own pocket because, some people are in such desperate situations, or, who could I refer? Who would maybe give a discount or maybe throw in a free consultation or something to just have some sort of intervention. So that's one level of the question. But the other part of the question is the dynamic of the workforce is changing. We have the introduction of other generations who are entering the workforce, who have a different tolerance level for psychosocial hazards, meaning that their well-being is their priority. And so we are seeing a proliferation of persons who we would consider the future of work, future leaders, future contributors to our workforce, who are leaving the workforce or who are not interested in leadership roles, who are opting to not even enter traditional work environments because they see their parents, their family members who, on Friday they got to go hit the bar or they got to have these bottles of wine at home because I got to take the edge off and they're looking at all of us and our coping mechanism and they're like, I don't want that. I don't want that for me. So twofold question. How are we going to stop the tide of the exodus of people from our workplaces who are feeling threatened by these psychosocial hazards? And then what capacity do we have to address these concerns in a cost-effective way?
So, very loaded question.
Yes.
I think the key drivers are, and I think that's been my overarching tone, there has to be training. The sensitivity of this new world of mental health, which is not new, but newly embraced, has to be addressed. We have to answer the questions at all levels and help with the sensitivity training and all the training that will come along with it, but that comes from leadership commitment. As Dr. Thomas mentioned, the framework is now in place, of which he was a part of the process, but we have to ensure that there's the commitment of leaders to drive and ensure the enforcement of the legislation after the training. But when we talk about costs, I want to specifically speak to something that I'm very excited about, and I was very excited about the Mental Health Act being passed and the legislation that comes as a result. But now we build on this. The Ministry of Health and Wellness is now is about to roll out components that speak directly to wellness, which captures the mental health aspect. And that will include costs in terms of what services are accessible to the people. From a public service perspective, we have in various ministries and departments, and this should happen across all, and this is where the framework will help. Once we identify employees that are struggling in some way, we have various chaplains, we have various counselors that are attached to the ministries that are to provide the counseling to employees. Some employees may not know this, but you can check in with your HR department, your PS, your supervisors regarding the need to check in with counselors that are attached to your ministry or department. Don't have the obstacle, or don't think that there's the obstacle of, I probably need to see someone, but I can't afford it. Options are available within the public sector, and most private sector companies are now engaging these employee assistance programs. Shameless plug. In my constituency, from 2022, I've been providing free mental health support to constituents. And that has proven to be very beneficial. It's confidential, it's free, and it's an opportunity for persons to address the issues that they feel they have. In terms of the high turnover, low tolerance of the new workforce that we are seeing globally, as I speak to labor ministers across the region and the world, it's the notion that my peace is more important than my economic stability. And a lot of mental health issues, while they may be tied to economic instability, peace has been proven more valuable. So you see this low tolerance for employees, especially our younger employees, like they say simply, I'm putting up with this. So this is, again, a matter of how we communicate, how we handle our employees. What type of environment have we created to ensure that when employees are feeling these frustrations, they're able to manage it to the point where they don't have to make such rigid decisions as to cut off their sustenance, which is their job. So this is Dr. Thomas used it. It's an awareness campaign that needs to happen. Awareness campaign from a localized perspective, in that we have to ensure our employees understand what resources they have that are able to be engaged, not taking for granted that employees know that resources are accessible to them. From a national awareness perspective, the Ministry of Health will be leading this charge in wellness, in terms of ensuring that we let citizens know that your mental health is important. No, it's not taboo. And here are the resources that you can engage that are available to assist you. And usually doing these things, as you know, from a national perspective, the costs are minimal, or there are none as we engage through these. So that is why we have a Ministry now of Health and Wellness, because we want to speak to the whole person. And that wellness comes with, in most instances, has a lot to do with our mental health.
I love that. And I actually loved that rebranding of the ministry to add wellness to it. I thought that was brilliant. And both of your ministries, I think, are doing concurrently some amazing reformations that this country is going to benefit from for many, many, many years to come. The work that the Ministry of Health and Wellness is doing, even in the area of violence, is now a public health matter.
Yes,
And
yes.
getting ready to really look at, and for myself as well, in some conversations with them about the matter of workplace bullying and bullying on the whole. I mean, this has just become so prevalent, not only in our schools. You think, well, it's primary school and high school and all of these things, but it is everywhere, even in church. And so we have to take these matters very, very seriously, and really put the frameworks in place from, governance all the way down to the everyday person and the things that we need to do. So as we get to conclusion, Dr. Daniels, I'd love for you to share some examples of what specific psychosocial hazards would look like for someone to then walk away and say, you know what, I think my workplace is not safe. I think my workplace is toxic. What are some of the things that they may experience on the job? You're muted.
My turn.
Yes.
So psychosocial hazards exist everywhere all the time. That's the first. I mentioned this before. Let's not be naive to believe that our environment is totally sterile, because it comes with the person. And this isn't, though it isn't a personal thing, it doesn't mean that you're a bad employer because psychosocial hazards exist. Just like you're not a bad employer if you have, chemicals in in your environment. It doesn't make you a bad employer. It makes you unconcerned about people's safety when you don't do anything about it. The hazard exists, you know about it, and you do nothing about it. So psychosocial hazards emanate from three sources: the work itself, how the work is organized, and the social interactions in the workplace. So again, it could be anything depending on my background, my expertise, the last job I worked. Many people come from their last job with a trauma. So at my last job, I had a bully for a boss. And let me say this I'm also a violence prevention specialist and an affiliate of an organization called the Workplace Bullying Institute. So bullying is three things. It is unhealthy, aggressive behavior that comes from a person with power that happens over time. So it's got to be all three things. And it more often comes from people in positions of leadership, not because of the leadership, but because of the power in the leadership. It's the position of power. So if you were in a position of power over me, it's hard to bully me when you have no power over me. But when you are my supervisor, when you are my team lead, when when you are the entire group of workers and and my job is dependent on whether or not you get, so we can use power in different ways. And often this is the challenge around bullying, is we don't really define what it is. So people fill in the blank. So just because we're having, a disagreement doesn't mean I'm necessarily being bullied. And so it's important for organizations to define what it means, because some of the folks whose behavior is bullying in nature is because we've never given them any other tool. They got promoted because, as the minister mentioned, some people think that tenure and competence are the same thing. You've been around long enough, you must be good technically, so we put you in charge of people. Leading people is an art. Managing is scientific, but leading people is an art because the people are different. And so, back to the original question, how do we determine whether or not this is toxic? How do we determine it's toxic from a chemical perspective? Because you have an uncontrolled hazard that people are being exposed to and potentially being harmed from. I have an instrument that I developed in my research called the psychosocial hazard inventory. There's also a hazardous material inventory that you would use for a chemical. It's the same thing. Identify it, assess how it's potentially harming us, and do something about it. It's not really all that complicated.
Good. Minister.
Thank you, Doc. That was a mouthful. I wanted to kind of piggyback off of that in regards to bullying in the Bahamian workplace. It has so many faces. It had so many methodologies. Bullying can happen where it's in the form of gossiping, which is huge.
Ooh.
Huge here.
Yes.
I touched on the cyber, but there's also having, how do I frame this? Having your opinions ignored is a form of bullying that happens top down in most instances. You're not at that level that you should provide this feedback, or you shouldn't know these things, so we're not going to consult with you. There's also the withholding of information and withholding of opportunity. So when we get into bullying doesn't look like how it looked in the schoolyard. Bullying can look so many different ways. And if you were to, I think there was a survey conducted to 2021, I could be wrong, about the fact that workforce bullying does exist. And to the level it exists, or it was almost up to 30% at that time. But another important component that contributes to mental health issues in the workforce is also another B, which is burnout. And I saw it in the comments, and I agree, especially amongst medical practitioners. That's the doctors, that's the nurses, where they show signs of burnout that then leads to mental health issues, that also leads to, and we hear a lot about it as well, interactions with their patients. So this you don't have enough time today, Ms. Simmone. Let's start there, because I think we have to understand that this is such a huge dynamic that we will continue to evolve in the way that we manage, create policy, and create legislation. But I'm so happy that we're starting. I'm so happy that we're becoming sensitive. Mr. Farquharson spoke about the occupational safety and health, that he has been bullish at ensuring that we get this done. But there's so much more to this whole conversation of mental health, that we have to continue to have these type forums. We have to continue to try and ensure that there's public awareness and awareness amongst leaders, but also that we continue to provide the resources and access to the resources that are critical for addressing this in the wide scale.
Absolutely. Thank you so much. Very well said, Minister. And that is the truth. We have to be mindful of the very subtle ways that these psychosocial hazards, bullying, violence, exclusion, and all of these other things, how they impact people's mental health and well-being, you know, and how comfortable I feel. Again, going back to, you know, the Sunday anxieties, you know, the Sunday frights. Hey, what? I have to go back into this workplace again. I have to continue to deal with these toxic people, you know. And so, yes, today was just a taste to raise awareness that it does exist. We see you, we hear you, and that things are happening from the highest levels of our country, and that we all have a part to play. You know, let it not be said that we are the ones being toxic, and also that we are being silent. I think a large part of the challenge that we have is people just not feeling comfortable enough to speak up, and sometimes having to face the consequences. This can be a lonely road, you know, if you're the lone voice that's crying out in the wilderness. So we must come together. We must continue to agitate for change. I see you, Nav, but you cannot give up hope. Don't give up hope that things are not going to change. We all have a part to play to make a difference. I put in the chat a link to an informal survey that we're doing through Limitless Life, but we want to get a taste of, we're always quoting from Dr. Daniel's country, statistics that we get from the US. So we just want to do an informal survey, and we'd love for you to complete that survey on your perceptions of workplace safety and your experiences. Please share it widely among your colleagues, your family and friends, so that we are able to put that data together. And that also helps to feed what we need in terms of putting things in place and continuing not only the conversation, but the actions that are needed. So I want to give each of our panelists an opportunity to just share their closing remarks for today. And I want to just say my immense heartfelt thank you to all of you, each of you individually, for your yes and for the work that you are doing to make a difference in the area of workplace safety. So we will start with our Honorable Minister and move along accordingly.
Well, thank you, Simmone. I see a concern and I want to address it head on, as I always do with these things, that, you know, this is a great start, but this is where we start. I always stand as a policymaker on legislation. You can't have any framework unless you build it, and now we're building the framework. As you mentioned, we are making reformation to existing legislation. We have enacted new legislation. Mr. Farquharson is going to be a part of us ensuring that we get our Health and Safety at Work Act reformed, but that's where it starts. That's the baseline. Legislation and, of course, enforcement, and that's up to us as leaders to ensure that that happens. But the important thing is to ensure that we're now ensuring that we're present in the space and letting our workers know across the country that this is something that is important. And they always say, what's important is where you put your resources. We will be putting the resources behind it. But without the framework, you can't build on it. We're building because we're putting the framework in place. So I'm confident by the work that I'm seeing done. Thanks to you, Simmone, Mr. Farquharson, everyone, Dr. Thomas, that has been involved in the process. But the process is one of inclusivity. Everybody has a role to play, and I stand committed. I think I've been a great mental health advocate, and that's outside of my political life, to ensure that we keep the process going, because our national sustainability and our national development depends on it.
Absolutely. Thank you so much, Minister. Dr. Farquharson.
I do want to say thank you for the opportunity to participate in this very important panel today. I want to commend you as we celebrate Mental Health Action Day. I think we'd have more discussion and conversation as this. I think we need to start particularly in the private sector and the public sector, have the human resources directors vice presidents to become more well. And I think this is a good start, and I really commend you and your team for doing this. Looking forward to assisting you again in the very, very near future.
Thank you so much. I appreciate that very much so. Dr. Thomas Smith.
Thank you very much for inviting me, Simmone. I really enjoyed this exchange. I think you had just a whole lot of good information from everyone. I'm equally encouraged by the minister's pledge to see this through. And I would just want to continue to plug for accessibility to appropriate mental health care, an advocate for awareness and training for all.
Thank you. Yes, I am joining you in that. We're going to join forces. Minister, you have champions in us to make sure that we make this as widespread as possible. Dr. Daniels, our guest. Well, you know, no longer a guest to the Bahamas because you've already set foot on the ground now. And they say once you get sand in your shoe, you're going to come back and your family. So I want you to share with us your final words. And please tell us about how we can get a copy of your book, your latest hot off the press,
Right.
Psychosocial Hazards Are Real.
Right. Well, I was already family. My grandmother, Myrtle Edgecombe, was born in the Bahamas. And so it is such an honor to be able to be a part of this gathering. It really is. It's just so heartwarming because I hang out with folks talking about this topic predominantly in Canada and Australia and here in the US. And it is, there are 40 or so countries around the world who have taken a very similar approach that do have legislation in place. You know, and they're all doing it, you know, similarly, but different depending on what's going on in their country. But I see in most of those countries some things that are still missing, and often it is faces like our in this gathering that tend to sometimes be missing in those conversations. And so again, as the descendant, so I tell folks now, I guess I know why I don't like going places where it's cold because my grandma's from the Bahamas. So, but again, and Simmone, thank you so much. I can't tell you how, again, just how much of an honor it is to be able to see what you all are doing and to know that you have leadership. This is the first time I have ever heard an elected official talk about this, a person at the level of the minister to talk about this in this way. You all, you have something. I'm certainly encouraged to see it. And if folks, you know, want to get a few more tools for their quiver, I've dropped the link in the chat where you can go out and get a copy of the book. This book was written for conversations like this. It is to just get people to see it's a thing. That's all. It's not to solve the problem. It is to get them to recognize that it is one. And once people recognize it, particularly people who do care about other folks, who care about their organizations, who care about other people, this is just another tool that they can use to help create the kinds of workplaces that we all deserve. So again, thank you very much.
Thank you so much. And thank you to all of you. We want to release you to the rest of your day, but to certainly encourage you to also be champions of this, to be encouraged to speak up, to participate, and where you have expertise, to offer your expertise to this very important conversation and movement that we want to see safe, healthy, thriving workplaces. So on behalf of Limitless Life and the Thrive Well Corporate Solutions, and I want to say thank you very much to the Ministry of Labor and Public Service, our Minister and Executive Manager, to Dr. Thomas Smith, to Dr. David Daniels for being a part of this conversation today. Many of you have asked for the recording and we will make it available to you. Once you registered, we have your email address and we'll be able to send it to you. If the link was shared with you, I put my email in the address, in the chat, so you can just send your email and we can make the recording available to you. Thank you so much again and have a wonderful Thursday.